Have you ever gotten so worried about something that your heart started beating so rapidly and sweat was running through your hands, you had trouble breathing, and your stomach suddenly ached? Or have you stayed up until late because you were unable to sleep and there was a sense of danger, panic, and your muscles were excessively tense? If your answer is yes, then it is highly likely that you have experienced an anxiety attack. And this could mean, or not, that you suffer from an anxiety disorder. Generalized anxiety disorder appears as a diagnostic category in the third edition of the Diagnostic and Statistical Manual of Mental Disorders in 1980. This is a condition of extreme worry and distress that interferes with everyday life, causing other negative feelings such as fatigue, irritability, and restlessness. According to the National Institute of Mental Health, it is not the same as occasionally worrying about things or experiencing anxiety due to stressful life events. People who are suffering from this experience frequent anxiety for months, if not years, and it develops slowly. Now, why talk about anxiety, you may ask? Well, according to the World Health Organization, an estimated 4% of the global population currently experience an anxiety disorder, and the National Alliance of Mental Illness says that 91.1% of Americans have an anxiety disorder. After doing my research, and as someone who has experienced this on my own and who has seen members of my family struggle with it, I think it will be beneficial to learn more about anxiety. In my speech, I would like to let you know about anxiety. First, I will talk about the causes. Then, I will mention some types of anxiety that exist. And finally, I will talk about the treatments that doctors recommend. To begin, let's talk about common causes of anxiety. According to the Mayo Clinic, there are various reasons why people could experience an anxiety disorder. There are no specific causes. However, there are certain motives that can contribute to it. Like having experienced traumatic events and inherited traits, those can be key factors for people already prone to anxiety. For others, it could be linked to health issues. For example, chronic pain, diabetes, heart disease, and respiratory problems. Or it can even be part of the side effects of some medication too. I talk about the causes of anxiety. Now I will talk about its myths. The causes of anxiety disorders are usually rooted in childhood, so the effective therapy must focus on that period. False. Research shows that effective treatment focuses on the here and now, including new skills to manage thoughts, emotions, discomforts, and behavior. It is important to avoid stressful situations if you have an anxiety disorder to prevent you from feeling worse. Well, this is not true, because avoiding anxiety tends to reinforce it. Now that I have shown the causes, I will talk about the most common types of anxiety. I'm going to mention 3 types. First, panic disorder is when there are recurring panic attacks, an immense combination of physical and physiological distress. Next, a phobia is a persistent fear of an object or situation that is not necessarily harmful or dangerous. And finally, social anxiety disorder is the discomfort and fear of being humiliated or judged by others in social interactions. I have just talked about common anxiety disorders. Finally, I will show some treatments or ways in which anxiety can be treated. According to Donald Black, MD, Professor Emeritus of Psychiatry at the University of Iowa, antidepressants are widely used to treat anxiety disorders, such as generalized anxiety disorder, panic disorder, agoraphobia, and social anxiety disorder. Counseling and psychotherapy help you deal with the emotional response to anxiety. And a healthy diet, physical activity, and a good sleep schedule can help you manage the symptoms effectively. Now that you know ways to treat anxiety, let's wrap this up. First, I talk about the causes of anxiety. Then, I mention subtypes of anxiety. And finally, I showed some ways to treat the disorder. I hope that this speech has helped you be more informed about anxiety. And remember, you are not alone. There are another 40 million people, which is about twice the population of New York, who feel the same way. Thank you.